Johnson, and we have Brian here today with us. And Brian is suffering from a condition known as sacroiliitis, which is causing sciatic nerve pain all the way down into his calf. And so today we're going to be showing you how we find out if that's what it really is, first of all, and then how to correct that and treat that. So let's have you lay on your back for a second. And I'm going to do a test commonly known as, in the orthopedic and chiropractic world, as a straight leg raise test. And tell me when and if that starts hurting down in the pelvis. Go back. Right there?
No, it was hurting before.
Before that even? See? He did. Okay, now, if he's at, tell me when. About right there?
Yeah. I feel the pull in my leg.
So you can see that he's only at about 40 degrees here, and he's having pain. Now, when we do this, we didn't let it go. Go ahead and let it just drop in my hand. And we drop it down. Does that feel better? Mm-hmm. Okay, now, when I do that, does that cause that same pain? Mm-hmm. Okay, that's good, because that's usually indicative of a herniated disc. Now, let that just flop down. Now, this is called a Fabry-Patrick test. I'm going to cross his leg, and I'm going to contralaterally push that down. Is there any deep pain down here, or is it in your pelvis?
It's more here in my head.
See, the pain on the Fabry-Patrick is not actually in his hip joint, but coming from his right sacroiliac joint. Then we do the same thing on the other side, just to make sure and compare and check his right joints. Any back pain or pelvic pain?
On the side.
A little bit still on the sacroiliac there. Right. Now, but this one's a little higher, as you can see. It's about 70 degrees. Feel better down here? Just let it drop. Any pain in your back or leg there? Good. Okay, let's cross this one over. Let that flop down. This is, again, Fabry-Patrick on the left. Is there any deep hip pain, or is it still in this? Right there? Okay, now this is positive for actual hip joint pain, so we'll be adjusting that today as well. Okay, very good. Now let's have you turn. Actually, we're going to, check your posture first here. Oh, he knows how to get up sideways. That's good. Okay, now, as you know, we always check posture first. Let's flex your head forward and then backwards. Neutral. Now, looking at him from the rear here, we see that his head's tilted off a little bit to the left, and he is also translated a little bit to the left on the x-axis. But where he's having his problem, down in the lumbar spine and sacroiliac region, his whole pelvic structure has shifted to the right on the x-axis, and that's showing us that it's putting a lot of extra pressure on your SI joint right there. So the first thing we're going to do is come over here and have him lay on his back, and we're going to decompress his entire spine. Okay, scoot down this way just a little bit. There you go. Now we've got him pinned in there really tight on both of his ilium bones, which are ilii in the plural, and we are right on top of those, so that creates a really good stabilization point on his pelvis. And then we're going to wrap this towel underneath of his occiput in the rear, and that's where I get my contact. I'm not choking people with this. We're going to contact here. Take a deep breath through your nose. And let it all out. There we go, good. You should have felt that all the way down, did you? Not as far? Okay. Hang on here. See, his reflexes are also diminished from that sacroiliac pinch nerve out there. So when you get up sideways, I want you just to sit there for a second and I'll check your reflexes. We're going to check his reflexes right with the hammer now. So we're going to have him turn sideways there and sit. And anytime you check the reflexes in the patella, no, go ahead and scoot back. We want your legs just hanging. Now see, he doesn't have a lot of reflex in his patellar reflex, very low. So instead of a +2 equal and active normal, he's more at a +1. Now the ankle jerk is good. That's S1. So he's getting a lot of his problems really out of the L5 nerve root right there, which really comes out between L4 and L5. So let's come over here on your tummy next to him, Brian. And he lay there. But he does actually have palpatory pinpoint pain there. Now his right leg is short by 1/4 of an inch on the right. I bring it up, it gets even. I bet that tightens up, doesn't it, Brian?
Yes.
See, that brings his pelvis, raises it up, tightens up, and I bet it's sore right here on both sides. That sore?
My pain's
Yeah,
all right.
right up here. That's the lumbar.
Right there.
Okay.
On that.
Okay. See, he's having quadratus lumborum, multifidus, and erector spinae muscle pains right up above the sacrum and sacroiliac joint. Yeah. So what I'm going to do first is I'm going to adjust the sacroiliac joints on the x-axis and the z-axis. Then I'm going to have you lift your whole leg up on the right. There you go. There. We're adjusting his sacrum, straight superior to inferior. Okay, relax that. While he's got his sacroiliac in action. Go ahead and lift this one up now. See, this one doesn't come up as far either. There. And sacrum again. Now relax that. Now we're going to adjust his left sacroiliac on the x-axis and z-axis. Okay. Now I'm going to move up into his lumbar spine because he's had herniated disc in his lumbar spine previously. In fact, one of our earlier videos last year actually shows me doing a video, Brian, on the herniated disc treatment. It's where I had the Texan shirt on. That was on Texans Day, as a matter of fact, and the Texans have a new coach this year as well as some new players, so hopefully they'll have a better season than they did last year. There we go. Excellent. That one's out. There we go. You notice how my angle always changes here now. Because Brian's so muscular, I have to really use my elbow and get down deep, deep into his paraspinal muscles. And don't try these things at home, guys. I'm showing you these things to show you how we treat patients, not really for people to be doing this on their family or brothers or sisters or other people. You need to be a licensed healthcare individual to do these, and you need to be a licensed chiropractor to adjust the spine. So we're actually ordering a new MRI of his lumbar spine and pelvis so that we can get a fresh shot of his anatomical issues going on right now. MRIs are used primarily for soft tissue, which the disc is a ligament, so you consider that soft tissue, and it images the body through electromagnets, lines up nuclei, and shows you the very detailed view of the spine or whatever part you're doing the MRI on for the soft tissue. So you want to get an MRI when you have a ligament injury, cartilage injury, and sometimes even muscle injuries, tendonitis or torn tendons. You want to get MRIs on to check out their severity to determine whether they're treatable with conservative care or if they need to be referred to a surgeon for surgical repair. Okay. And also, we're going to be using the turbonator on him. He's got really tight hamstrings as well. a Black & Decker saw. It's converted. We had a patient make that one for us. It's a lot deeper than the old Terminator I used to use. Now see, that doesn't hurt as bad, does it, Brian?
Not as bad.
Yeah. Still tightens up though. So we got still some issues with that we'll be dealing with on him on his back. Okay. There you go. Just easy. That's it. And these are some just diversified manipulations on his thoracic spine. And he has just been very tight the last couple of times because of the muscle spasms coming off of his pelvis. So we're getting very little movement or cavitation whenever we do his adjustments in there. So let's turn you on your back now, Brian. And just lay with your head up here for me. We are still going to be adjusting his cervical spine. Yep, there you go. That's all right. Perfect. Good job there. And excellent there too. Okay. Now, anytime anybody has a sacroiliac problem, they're also going to have a hip issue. So I'm rotating his hip inwardly, and I'm going to do a real fast, high velocity, low amplitude adjustment, decompressing him from this end. Did you feel that up in here? Good.
I felt that in my back.
Right there in your back, that's good. So patients getting this done often will not only feel it in their knees, hips, but up into their lower spine, which is what we want. Nope, I slipped on that one. There we go, that's better. Okay, yep. Now, there's a different adjustment. Go ahead and pull the side up that way just a little bit more. And then keep that leg up.
Can you fix this?
Yeah. There you go. Now bring the right leg up and sit. Now what I'm doing right now is a different way to adjust the sacroiliac, because you're contacting it from the anterior pubic bone. It's a very painful adjustment to have done, but it's also pretty effective in moving the sacroiliac joint too, so that's good. Okay. Let me adjust his feet and his toes, because he's been getting some pain down his plantar fascia area recently. Okay, let's see this one. And as you can see, I've been bent over all day long treating patients, so I need to get my adjustment here pretty soon too. Okay, yep, there we go. Okay, now let's sit just face towards your knee. There you go. And we're going to check his shoulders, elbows, and wrist out like we always do. Excellent. Yes, both of those move really well. That's the glenohumeral joint that I'm adjusting. That's the ball and socket joint of the shoulder. His elbow's doing pretty good, actually. There we go. We adjust the carpals, carpal tunnel bones, and then the phalanges also, which are the fingers. There, much better on that one. Okay. Brian's an engineer, so he looks down a lot, works on the computer, and unfortunately has to sit a lot of his day. And sitting has now become one of the major health hazards in America. Okay, let's come over here. Now we're going to retrain his cerebellum to hold his biomechanics in a different configuration. So I'm going to use this high velocity, low amplitude instrument. And we're going to mirror image everything. So lift up and back, flare. I want you to shift your pelvis way to the right. Yeah, hold that right there. That was a lot stronger, wasn't it? There we go. Okay, now relax. Okay, now let's try that same thing one more time. Very good. And we got grade alignment up top, but I'm still got something I need to do with his pelvis. So go ahead and come straight back on this one here. Now I want you to shift as far left as you possibly, there you go, good. We're trying to get his pelvis centered up. So we're changing the proprioception from his cerebellum all the way down through his cord, and hopefully now his pelvis will be centered better. Good range of motion, posture's good, shoulders are squaring off. Yep, look at your pelvis more in the center now too. Very good. Okay, this is sacroiliac problems with sciatica. If you have them, call us at Advanced Chiropractic Relief and we'll help you with those. And until next time, this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.